Hey, how you doing, guys? So this is Dr. Specific Chiropractic. So we actually have a swimmer over here, and you've been experiencing with neck pain, shoulder pain, low back pain. Okay, so there are particular biomechanical patterns what swimmers do to their bodies. So we're gonna start breaking things down, see what's going on with this one over here. Okay, so as I said, you've been swimming, competitively past 4 years.
No,
okay?
competitively like 2 years.
2 years, my apologies. So competitively 2 years, but you've been swimming, you got the swimming bug, you caught it 4 years ago, right?
Yeah.
So let's break it down each style. So which style you do the most in the swim team?
Freestyle.
Freestyle. Okay, any particular positions you notice while doing freestyle that causes some discomfort?
Like right here.
Okay.
Like, yeah. Like, I don't know how to explain it. It's just...
Okay, trying to duplicate that pattern. Go ahead. So,
that.
so this is, and where do you feel the discomfort or trouble?
And like my shoulder part.
Back over here.
Yeah.
Okay. And what about butterflies?
Butterfly just like right here. Like.
So when you go into max extension.
Yeah.
Got it. So when you go into maximum extension over here with your shoulders, where do you feel the discomfort or trouble doing?
Like just this whole entire part.
So the upper back over here.
Yeah, upper back.
Okay. All right. And let's see. What about so we did butterfly. What about
Breaststroke.
breaststroke? Yes.
Like this. Like opening.
So what do you have trouble doing so when you do that position?
Still my upper like back.
Upper back.
Mm-hmm.
What about backstroke?
Like right here, and like maybe like my lowerish back, but also my high back, like so my upper back.
Upper back as well. Okay.
Yeah.
And also, while you're doing the freestyle, do you notice any problems elsewhere in your low back?
When I'm doing freestyle, it hurts a little bit in my.
Can you show? Let's show it to the viewers over here. So where do you usually feel it?
Right here.
Right here. So it's going to be the lower dorsal region over here in upper lumbars. There is a recurrent theme to all your strokes you mentioned about the freestyle, breaststroke, backstroke, and the butterflies, all those. Okay. Mm-hmm. So every time you talk about, says, okay, I got a lot of problem with abduction.
Yeah.
Okay, and extension as well.
Yeah.
So that particular muscle is called the latissimus dorsi. Okay, and this muscle over here, okay, attaches from here, goes all the way straight down to over here, to this region over here.
Yeah.
Right. In addition to, we also have the shoulder blades over there. Okay, and now you're also talking about when you try to do all the other styles. Okay, I feel a lot of discomfort around this region and muscles here. They're not happy over here as well. Okay, in addition to, also here as well. Okay. So therefore, there's going to be multiple factors, but more importantly, I'm going to take a look what's going on in the lats itself. That's restricting your range of motion, so you can't do all those strokes as efficiently and effectively as possible. So we definitely going to take a look, see what's going on in this region over here, and also all the other potential trouble spots. Now, when we take a look at this spine over here, right, I want to make sure your foundation is stable and level. Why? Because even though it says, hey, doc, it's actually I have a shoulder problem. Why aren't we talking about the shoulders? Well, here's the thing. When we walk, are we walking like stiff like this? Mm-hmm. Or are we swinging our arms when we're walking?
Swinging our...
Correct. So it's a counter pendulum effect, what's going on in the foundation itself. So therefore, if there is a problem in one of your hips in the foundation itself, it's gonna have this effect to the shoulders itself. Okay, so in other words, you're not gonna move as smoothly as possible. All right, so we're gonna show to the viewers right now. As the viewers can see, in terms of your gait analysis, you're really swinging your arms. Okay, so that tells me that, okay, what's going on in that foundation? Now, ideally, I want to see this foundation to be level, but I'm seeing you're sinking down a little bit this way.
Yeah.
All right. So as a result of that, since you're listing a little bit towards this way, okay, then it says, how do I get my head level like this? I'm over here. The body got to compensate somehow, right? And we're going to get you more centered. So what your body starts doing is from here, okay, because you're leaning this way and you went a little bit this way, this area follow along with that. but it continues that trend, and that's why I keep on going over here. And this part over here, it kind of twisted, like this. Add to that more fun fact is that we're actually swimming. Okay, so when we swim doing freestyle, breaststroke, all the other styles itself, what we're doing is we're basically like twisting this entire spine itself. It's not just like, oh, just one little area over here. No, we have to look at the whole full picture. So your entire spine, like here, when you're swimming, we're going like this. Yeah. That's what normal's supposed to be. But instead, your spine is already locked here. Okay, so when we swim, you're twisting even more tension. So you may find it says, hey, wait a second, I could swim a little easier with my left, but why my right, it can't move as well. I don't know if you noticed that pattern. Yeah. Have you noticed a little trouble on the right side, right? So, exactly. So that's why it doesn't surprise me, all those biomechanical patterns you're doing to yourself. It says, hey, wait a second. So it's like, I'm already twisted like this way, so I can easily swim this way. But when I try to do it in my right, it says, I'm already locked in this position. I can't, I have a hard time, swinging my arm this way, okay? So therefore, I wouldn't surprise me on the examination, this right hip may be the actual culprit. I'm gonna take a closer look at this one. But in addition to that, and that's what I'm seeing here in the lateral, we do have something going on with this fourth lumbar. And this is where the usual attachment site for the lats. So this is also something I want to take a closer look at on you. Okay? In addition to, for the more, since you've been swimming competitively for 2 years, for those who swim even longer than that, okay, or those who really mess up their pelvis, there's a common pattern I see most swimmers do, is actually they knock it at number 2. And I already see your number 2, okay, it's kind of not happy already. See, it's already like tilting away, right, for number 2. So this is already, I wouldn't surprise me when you finally get into high school a couple years down the road, says, hey, what the heck is going on over here? And every time I do their freestyles, it's like this over here is like, this is really not happy over there, okay? So that's why your body is trying to, I know it's a little hard to explain this because we're only doing 1 dimension, but we also have to look at the full 3 dimensions. So every time you're swimming, okay, it's this. We're constantly doing like this motion to your spine, okay? So therefore, since your whole entire spine is already rounded out like this, okay, how well can it swing this way? Okay, it's going to have a hard time. So this counterpoint over here, that's why it's going to be very uncomfortable over here. And that's how most swimmers, they knock out that upper lumbar, that second lumbar over here. It's a very common thing I see amongst swimmers over there. Okay, and the next part is because your whole entire spine is like right in the middle over there. That's why this one over here, that 6th dorsal, that's not happening. Okay, so we'll confirm that on you. 2nd dorsal, we have a side slip over there. That means your body is so twisted up, like I explained before, like a rag over here. Look at this over here. Okay, normal when the body moves, okay, it should be like here. But if you're twisted so much, and that's where these fall over here, no matter how much I rotate, see this? It hits those ends. Cannot like keep on going unless you break it off, then it'll go like way off that way, okay? But no, that's where the physical limitations are. However, that being said is, if we rotate this so much, see what happens over here? Yeah. Okay, it twists so much because over here, can't go anymore, but it wants to rotate even more to try to like go way off that way. But since it can't, it goes so much over here, then we start to see this bone sticking out. Well, congratulations. See that number 2? It's bulging out. So this is what we call a side slip. So you're twisted up so much from down here from that right hip, it's causing that. Now, why is that an additional component? Because Biomechanical, that fellow over there, deals with our clavicle, okay, the collarbone over here, okay, and also Biomechanical with your shoulders as well. So therefore, when you try to do the freestyle, breaststroke, butterfly, so on and so forth, that fella is always gonna, it's like a kink. It's just like, what the heck? It's like, I'm trying to move the right shoulder. It doesn't move as smoothly as my left. It's like, left, oh, hey, not too bad, but the right is like, it's sort of stuck there, right? In addition to, I do want to see what's going on with the lower cervical over here, because these discs over here, they are swollen. It's bigger than these fellows over here. See that fellow over there? That's a normal size, a normal height. But see over here, it's about roughly 25% taller to these fellows. Same thing with number 6, also taller than everything else. So these two over here, I'm gonna take a look closer on you. Says, okay, let's see if you got an issue there. Because these fellows also, they supply nerve power, nerve function to your shoulder blades. So our first thing we do is inspection. I want to take a look. What are the potential swelling spots? Do we see any tight muscle spasms? So everything is tight and swollen over here. Not too bad over here. But see this bump? Okay, a lot of swelling on the right hand side. Not too bad on the left side. And this is that second dorsal level. Quite puffy over here. Tender right here?
Yeah.
See, I'm barely touching it, and she's not happy about that fella. What about here?
It hurts.
Yeah, looks like that second lumbar area. What about here? The same as well, right? Yeah. Keep on going further down. Now we can see there's something going on over here, because why is this puffy? See this? It bounces decently. Oh, here, see, I'm barely touching it. She's already flinching in pain. So the body's trying to stabilize and protect something over here. So let's confirm that with instrumentation. Okay, so with instrumentation, we want to confirm any potential levels we want to take a closer look at due to the fleeing nerve and the fleeing disc as well. What, a little ticklish or painful?
Yeah.
Ticklish. And number 4 is going that direction. And
That hurts a little bit.
yeah, right inside joint. No big surprise. Second dorsal's not happy. Okay, no, look up, please. There you go. Slight little reading on that. So since we confirmed that is tender, yep, she doesn't like it. So we're testing left hip. Yeah, that's moving just fine. Testing sacral segments. Decent. Okay, not great. It's a little bit out there, but there's right hip. Yep. Not too happy, huh?
Yeah.
Yeah. Now let's check. 5th lumbar, decent. 4, nope, that's a brick wall. That's not moving at all. So 4th lumbar. Let's check your 2nd lumbar. Let's see, this is semi-fixated. So my expectation is once we address these two fellows over here, your spine's gonna unwind enough that the 2nd lumbar, I'm expecting this fellow to start calming down. So you're a little tight there too, right?
Yeah.
Yeah. Now, just because I'm marking all these areas doesn't mean it's adjusting. So again, I'm expecting for this fellow to calm down after we adjust these two over here. And how's this fellow right there?
Oh, that hurts.
Yeah. Here's your 6th dorsal. Your body cannot adapt to that fellow. How about this fellow right there?
Hurts.
2nd dorsal. Pain right there?
Yeah.
So the other component with swimming, because she's doing the breaststroke and the butterflies, what have you, the way the swimmers do it, they like cocking their head and extension all the time like this. So it's going to constantly aggravate this. But because she's so young and started at 2 years ago, what have you, the damage itself hasn't really manifested itself too crazy well on that one, because what we're going to do is wait until you get to high school and keep on doing this. Eventually this fellow over here is going to start really become unhappy, and that fifth cervical nerve goes to your elbows, your thumbs, and that finger over here. Just fine. Deeper. Good. Okay, let's try the right shoulder. How's the right shoulder?
It feels better, in a way.
Yeah. So your 2, it's already calming down. So your 11th dorsal slightly out. So I wouldn't be surprised if 11th disappears after we address this 4th lumbar. Okay, nice of the way. Okay.
Doesn't hurt.
Which one doesn't hurt?
Like both of them.
Both of them.
Yeah, they don't hurt anymore.
Good. so you're successful. We relax the lats itself.
Oh.
Now try everything. Freestyle. How's that now?
It doesn't feel like anything is bothering. Nothing's
What about
bothering.
butterfly?
Butterflies.
Mhm.
Wait. It's not. It doesn't hurt.
Pretty nice, huh?
Yeah.
Okay. Butterfly. And what else is it? Breaststroke. How's the breaststroke? Still.
Not really.
Because I see you're not gliding too on this right one. Now I'm testing the shoulders itself over here. We're checking for the SC joint. Okay? This is not moving too well.
Yeah.
AC is moving decently. See, you have a little humerus problem, not too bad. See, this is moving fine. Okay, no fixation in the SC joint itself. AC is fine. See, actually, you don't really have shoulder problems per se. It's this SC joint that's fixated. But biomechanically, from this SC joint, neurologically, and biomechanically is actually from the second dorsal vertebrae. It's from the side slip. So, here. I'm gonna get the side slip. It's very inferior. There it is. Right there. Yep, it's this way. This is also. There it is. What? Freestyle?
Yeah, it doesn't hurt any.
What about what are the breaststroke and butterflies?
Not really. It doesn't hurt.
Do you feel, how's your range of motion? How's your mobility in your shoulders when you do both in the butterfly and the breast?
Well, like, what do you mean?
Because like earlier what I saw on you, biomechanical, you had some trouble with that right shoulder, so you didn't have full range of motion in comparison to your left. So give that right shoulder again.
It feels like I can move it better.
Move it
It's like
better.
not tense.
What about doing the breast and the butterfly?
It's not as tense as it was
Good.
before.
How's this right now?
This, it doesn't like really hurt anymore,
Good.
and I can move it more.
Good. Anything else?
No, it feels better now. Like I feel better.
Nice. Are you ready for encore? Okay, so to the viewers, what I'm seeing over here, and this is very important, especially for swimmers, okay? Some of your power comes from your feet, all right? So we want to make sure your feet are in tip-top alignment, especially now you're going to try to start diving. So in order for you to execute your technique properly, when you do those, nice little rolls into, off the diving board, we want to make sure your feet tip-top condition. So when we take a look over here, and you guys can see over there, no, just stand still right over there, okay? Just put a regular position, your feet. Okay, so what I'm seeing here already is this, okay? Now, if we had a proper intact lateral arch, okay, I don't want to see this thing bulging out. But the right side is bulging a lot more than her left. The left is bulging a little bit. So usually that's due to a cuboid problem, so I'm going to take a look what's going on there. But see how flat her toes are? Okay, normal toes should have a slight little curvature like this. I don't want to see it like flat like that way. And that's what I'm seeing over here. So that tells me that the transverse arch, and that's what I'm feeling over here, is partially collapsed. Medial arch is also partially collapsed. So let's go ahead, let's take a look at everything else. First thing first, we want to take a look is how's your talus doing? And they're both stuck. Yeah, this we're set right now. There's that one. See, this one's also stuck too. There we go. There's that fella. Okay, now we're gonna rebuild everything else on this. See, this cuboid here, it's not moving. So we're gonna set this first. So we're gonna set this cuboid. Here's that fella. This cuboid is not as bad as the right, but we still gotta set this fella. There's that fella. So your second cuneiform is inferior. It's sunken downward, so we're gonna pop it back in. Set that. Hold on, relax the foot. Just like that. Cuboid's still a little bit stuck. There we go, now it's moving. Let's check this fellow over here. Yeah, second cuneiform, this one's also out too. There we go. Supracubital, lift it up. Here's the rest. Okay, go ahead, walk around. See you like them feet.
It feels good.
I'm sorry, say again?
It feels like better than how I was walking before because I was kind of.
You're walking on the outside of your feet,
yeah.
right? Yeah. So tell you what, on your next visit, after you do a swim meet, let us know. How's everything coming along? All right?
Okay.
Okay. Well, that's it for today.
Thank you.
Oh, you're welcome.